I'm going to go ahead and talk you guys through putting in an NG tube and removing it. So the first thing that you need to do is make sure that you check your physician's order. He's going to tell you what type of tube, what it's for, and whether or not he wants it to suction. So you need to make sure you're checking your physician's order. Once you have verified that, then you would go to your supply room and get the supplies that you need. You're going to need your NG tube, which you're going to pick based on what you're doing it for. We talked about that in lecture. You need some water-soluble lubricant. I've got a cup of ice or water for our client to swallow, tape, gloves, a 60 cc catheter tip syringe, our stethoscope, and also if your room does not have suction equipment, we would need to make sure we take that in with us as well. So we have our equipment ready. So now we're ready to go in the client's room. So knock on the door. You enter the client's room. Good morning. My name is Tara. I'm your nurse today. The doctor has ordered for me to put in an NG tube to help with the nausea you've been having. Have you ever had one before? And they'll tell you whether or not they've had it. Go ahead and perform your hand hygiene and identify your client. So ask your client their name and their date of birth. Check their armband. Okay. Ms. Smith. Ms. Smith, do you have any allergies to latex or tape? She tells you that. Have you ever had any kind of facial trauma or sinus surgeries or anything to your face? And she tells you yes or no. This is important because if she told you yes, you would want to verify with the healthcare provider before you insert this because of the risk. Okay? And go ahead and tell her what we're going to be doing. It's going to be a little bit uncomfortable. It's going to go in through your nose, down through your throat, into your stomach. But it is going to relieve your nausea and help you feel better. Okay? So at this point, I'm going to go ahead and put her head of her bed up. She needs to be in a high Fowler's position because of the risk of aspiration. Go ahead and set your suction equipment up. You would have a suction regulator. And then you would have a canister that would hook to tubing for your client. Remember we talked about in lecture that NG tubes are intermittent suction, not continuous. And the doctor will let you know whether or not it needs to be low, medium, or high. So we've got that hooked up. I'm going to go ahead and raise her bed up to a comfortable working height so that it's easier for me. I'm going to go ahead and start preparing my equipment now. I'm going to take my tape. I'm going to do one piece and tear it in half like a pair of pants. I'm going to take a piece of tape to secure it to the cheek. A piece of tape to mark the tube. And then a piece to put across the bridge of the nose. Okay? Alright. Go ahead and get my ice chips handy. Go ahead and open up my catheter tip syringe. I'm going to go ahead and open up my tube. At this point, if you had a packet of lubricant or if you had a tube like this, you would open your lubricant and you could squirt it into your paper and it would make it easier for you to be able to lubricate. Okay? I'm going to go ahead and put my gloves on. Okay. Right. I got my stethoscope. I'm just going to sit it right here for me. Okay. And I'm going to go ahead and draw up 30 cc's of air and hook to my NG tube. This will kind of help when you insert it from gastric content coming out. So I'm going to go ahead and hook that to it. At this point, I'm going to go ahead and measure my tube. I measure it from the tip of the nose to the ear down to the xiphoid process. Okay? And I put my piece of tape to mark it. Okay. And this is not a sterile procedure, so everything's clean. All right. You could go ahead now and, all right, Miss Smith, I'm going to look at your nose. And you can look at the nose with a pen light and see if there's any septum deviation or anything that would block you from being able to use one side or the other. You could also ask her to sniff, and which side had better airflow would be the one you would want to choose. Okay? All right, Miss Smith, we're getting ready to get started, okay? It's going to be a little bit uncomfortable. What I need for you to do is if you start feeling like you can't breathe, you wave your hand at me and let me know, okay? I also want you to give me a thumbs up if you feel this in the back of your throat, okay? So I taught her 2 different signals so I would know what she needed, okay? All right. I'm going to go ahead and lubricate my tube very, very well. You need to make sure that it's curving downward. All right, Miss Smith, we're getting ready to get started, okay? I'll go ahead and insert. And they may start, you know, being a little uncomfortable. And she gives me a thumbs up that's in the back of her throat. All right? So I would ask her to flex her head forward. And what this does is decreases the chances of it going into the trachea. So she flexes her head forward. I get my ice chips. I give her some ice chips. Okay, we're flexed forward. I ask her to swallow. And each time she swallows, I advance the tube. Swallow. 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 Okay. Right, and I would advance it until my measurement. But on the mannequin, it won't go any further. So I would advance it to my measured mark, okay? So once I got it there, I'm going to temporarily secure it to my cheek. Because I don't want to permanently secure it until I check placement, okay? Like I told you guys in lecture, the textbook doesn't really recommend the air bolus anymore because they say it's not real reliable, but you will see it in practice. So I will go ahead and show you how to do that. So you would take your stethoscope. You have your 30 cc's of air. You would listen over the stomach, inject your air. You should be able to hear it in the stomach. Then you would want to aspirate gastric content. And it should be green or a tan color. Go ahead and clamp your tube off so that you're not getting any gastric content on you. If you have pH paper available, you would test the pH of the fluid. Alright, and now I would go ahead, and this should have like a little adapter, and I would hook this to suction. If it wasn't supposed to be hooked to suction, you would just clamp it off. Okay? Once I've verified placement, then I would secure my tube. I'm going to release it from the cheek. Go ahead and put another piece of tape across the bridge of her nose to help reinforce it. Then you could take either a commercial device or a rubber band and a safety pin or even some tape and secure it to her gown so that, you know, it would decrease the risk of pulling it out. Okay. All right, Miss Smith, are you doing okay? She says she's doing okay. So if she had started waving her hand at me and told me she was in respiratory distress, then I would pull the tube out slightly and try to give her some time to recuperate, and then I would try to reattempt to insert it. If she still had trouble, then you would just take it out and begin again. If you have trouble going into one nair and you have resistance, then you would want to try the other nair. You wouldn't want to keep trying to push against resistance. Okay? So once I'm done with that procedure, I would put her in a comfortable position. Generally, when they have an NG tube, you don't want to drop them lower than 30 degrees because of that risk of aspiration. Give her call light. Lower her bed all the way down to the lowest position. And you would pull up your side rails, take off your gloves, perform your hand hygiene, and then document. Okay? So that's the insertion. So now let me kind of talk you through the removal. Again, you would have to check your physician's order and make sure that you had a doctor's order to take it out. You would need a towel, your gloves, and a 60cc syringe again. You would go through the same procedure of coming in the client's room, performing your hand hygiene, verifying you had the right client, explaining the procedure. Go ahead and you would put her in a half hours. Okay. You would make sure that you put your gloves on. Go ahead and you can cut off your suction equipment. You go ahead and draw up 30 cc's of air in your syringe. Put your towel across her chest. Alright, Miss Smith, we're getting ready to take your tube out, okay? It's not quite as uncomfortable as when it went down. So I have her towel across here. I go ahead and I'm going to clamp this and unhook it from suction. And put my syringe in here. Go ahead and push in 30 cc's of air. That just clears that tube of any kind of stuff on the end of it. Okay? Alright, Miss Smith, I'm going to loosen your tape. Sorry. Okay. Alright, Miss Smith, when I count to 3, I want you to hold your breath, okay? So 1, 2, 3, hold your breath, and as she's holding her breath, you would remove the tube, okay, and wrap it in your towel, and then you would dispose of this in the biohazardous disposal, okay. She may want you to clean her face up, give her a little bit of oral care. Alright, Miss Smith, does that feel better? And go ahead and give her call light, put her in a comfortable position. Put her bed all the way down. Side rails up. You would need to dispose of your suction canister equipment because it'll have things in it in the biohazardous waste. Okay? Clean up your supplies. Remove your gloves. And then you would perform your hand hygiene. Then you go out and document. That's it.